Hey everyone, welcome to Food Talk Live. A reminder that this episode will also appear on our podcast, Food Talk with Danny Nierenberg. So please sign up wherever you listen to podcasts. I'm really excited to talk to Luke Saunders, the founder and CEO of Farmer's Fridge, today. They're based in Chicago, Illinois, and the company operates more than 400 automated smart fridges in the Midwest and the Northeast. They're stocked with nutritious, affordable meals that are prepared daily that are also really delicious. Leftover food is donated to food pantries or made into compost. And the company's mission is to make it simple and affordable for everyone to eat well. Farmer's Fridge has been very good to food tanks, speaking at or attending our events and donating food to us. So we love you and we love your staff, and love how passionate you all are about making healthy, delicious, nutritious food available to as many people as possible. Thank you so much for being here, Luke.
Yeah, thank you for having me. Thanks for all the compliments. I know the team appreciates it. This is amazing.
So before we sort of dive into Farmer's Fridge, one of the things that pains me, I think maybe the most about this crisis that, we're going through right now with COVID-19 is that, like almost every other crisis, whether we're talking about conflict or climate change, is that the poorest people will suffer the most, right? And whenever something like this happens, underserved communities lose a lot of access to any affordable and healthy food that they had. And so, during COVID-19 and other sorts of events, it's important for people to be, better nourished now more than ever and have these immune building sort of meals available to them. But that's not always the case, Luke, as you know. So can you talk a little bit about what's going on with COVID-19 and Farmer's Fridge and why you're probably more passionate about the work that you've been doing for so many years? You're probably more passionate about it now more than ever.
Yeah, no, I think a lot of cases where it's nice to have a healthy lunch at work, but when you're working in a hospital right now and it's 24 hours a day, 7 days a week, lots of
Right.
stress, it's even more important. Or if you're locked in your house, you don't want to go to the grocery store. And then we're also seeing a lot more need from our food pantry partners. So we actually donate all the food that we don't sell. And so across the board, it's definitely been a time where you really get reminded how important food is to people,
Yeah.
and how much of a difference it can make. So yeah, we've actually had customers that a few weeks ago were buying food from a fridge, and now they don't have a job, and so they've actually reached out. We've been able to send them a couple meals here and there, but we
It's
obviously
amazing.
have been really struck by just how much food is playing a role in this.
Absolutely. And it's so important to keep our healthcare workers who are on the front lines of this healthy during this crisis so that they can continue to treat patients. Can you talk about the work that Farmer's Fridge has really done with these frontline healthcare workers?
Yeah. So, I mean, to be honest, really, we have always been in hospitals. We have over 100 locations in healthcare and hospitals. And so when this started happening, we knew right away that a lot of our clients and customers were going to get impacted. And so we started reaching out and just said, hey, if there's anything that we can do, let us know. We implemented a 25% off coupon right away at all of our fridges that are still open,
Mm-hmm.
just assuming that anybody who's out and about is going to need a little bit of extra healthy food right now. And then in the hospitals themselves, we're actually going in and setting up mini fridges or doing catering drops, because what we found is a lot of the staff, they're asking them not to move between floors,
Right.
or they have to take off all their PPE, which is in short supply. And then just generally speaking, the stress level is much higher. So the hospitals
Right.
and the communities are actually trying to get more fresh, healthy meals than ever to those people. So we've been stocking, recharge rooms and bereavement lounges and places inside the hospital for people.
Yeah.
And we have our own frontline workers that actually have to make the food and get it in there. So it's definitely been a really difficult couple of weeks for us, just figuring out
Yeah.
that training
Yeah.
and all that.
I want to talk about that a little bit. I mean, how safety and procedures are obviously really, really important right now, but How are you keeping your workers safe?
Yeah, so on the kitchen side, we actually started right away with social distancing, temperature checks for people coming in. We have the benefit of having space in a highly controlled environment.
Yeah,
So we set up a lot of safety procedures around how people take breaks and the ability to interact. So we did everything we could on the facility side and also providing PPE there. But for the
sure.
most part, they have that in their everyday life. The whole idea in a clean kitchen is to keep your customers and your employees safe and protected. On the driver's side, what we started doing right away was getting people more PPE equipment. So like
Sure.
face masks, face shields, gloves, arm covers, gowns, things that they could change in and out of to keep themselves safe, and also just training to help them to understand like this is where you should go through the hospital, this is where you shouldn't, and then we implemented hero pay. So actually, everybody who's going into anywhere like that right now is actually getting paid more than they would normally. And early on, when we
Fantastic.
started is we were just trying to guarantee hours and make sure that everybody actually had their full shift.
Absolutely. That's wonderful news. I mean, I think probably a lot of businesses like yours are, nervous about employees quitting because they want to keep themselves and their families safe. So it sounds like you're doing everything you can to make sure that your folks are covered. And I think that hero pay, like, I've heard of other companies increasing pay for their workers, but not calling it that. So that's a wonderful thing to sort of make sure that people know that they are heroes, that they're doing incredible work to keep so many people fed. I imagine that you're also probably worried about your supply chain during this time because, farmers are feeling probably at risk and concerned about safety measures. Has that been an issue for you yet?
Yeah, it has. I think we buy through the restaurant supply chain. So when restaurants got shut down, a lot of the suppliers from the farms all the way through the distributors got hurt really badly by that.
Yeah,
And so it's been much tighter on inventory. You've got to plan a lot further ahead of time. Certain things are out of stock. Um, so it's not necessarily that there are shortages as much
hmm,
as planning became much more difficult because they're managing a volatile demand. And so we've had to just get much closer to our distributors, explain to them, here's what our volume is going to be a week or two out, which creates its own complexity and limits. We've had weeks where we've actually been trying to keep up with making the food, and if we can't predict the demand, we can't get the products in with enough time to make it. And then what we're hearing is there's going to be pretty big downstream impacts. So a lot of the
sure.
farmers that had products that they had to plow under or couldn't sell, a lot of the distributors that got hurt really badly by not being able to sell those products and having them go bad. Um, that could in 6 to 9 months actually affect like how much products available in the market because they're not going to plant as much right now.
Absolutely. Let's take a step back for the folks who aren't familiar with Farmer's Fridge and sort of explain the concept. We've been talking about these fridges and vending machines, but you have like very particular products that are served in a very particular way. So I want people to understand that more.
Yeah, for sure. So I started Farmer's Fridge almost 7 years ago, and the whole idea was make fresh, healthy food as accessible as a candy bar.
Mm,
And so the way that we did that is we decided to make the food in a central kitchen and then distribute it through our own supply chain of refrigerated trucks to the automated fridges that you'll find in hospitals and universities, airports.
hmm.
Even the 911 center here in Chicago has one. Um, and over the course of time, we've really kept the main part of our business the same, which is we get whole ingredients in, we prep them, we make dressings from scratch. So the whole idea is restaurant quality fresh food delivered at an affordable price, 24 hours a day, 7 days a week, wherever you are. Um, and yeah, that hasn't really changed. But what shifted is, a lot of our fridges are in offices or schools, and those
Sure.
obviously are closed right now. So we're focused a lot more on doing home delivery and healthcare workers now.
How
So
much of a pivot was that to go to home delivery? What did you have to put in place?
You know, I feel like the word pivot is really interesting because to me it implies that you have somehow fundamentally changed like what your business set out to do.
Sure.
And so for us, like we didn't actually pivot in the sense that we we looked at our existing assets. So we had delivery, we had production. The fridges obviously couldn't be as useful outside of the healthcare locations, but we had a relationship with customers. And we said our mission is to make fresh, healthy food as accessible as possible. So given what's going on right now, what's the best way to do that? And it happens to be to really double down on hospital care and going into people's homes, or leaving it on their doorstep, not going in these days. But
Sure.
yeah, so I feel like the way we distribute the food has changed, but the business is actually exactly the same, which is like, how do you make fresh, healthy meals more accessible? So
No, that's amazing. So you've been donating lots of meals and serving lots of meals. Can you talk a little bit about how that works and what sort of communities? So you're doing business in Chicago where you were founded. You're doing business in the Northeast. What does this sort of distribution process look like?
yeah, so we get the produce in almost 7 days a week. So we're getting like whole heads of lettuce, whole nuts and avocados and all that good stuff. I think we carry over 150 different fresh ingredients. And then we prep all of that stuff in our central kitchen. Once that food is prepped, sorry, my phone.
That's okay, no problem.
Once that stuff is prepped, we actually assemble all the products and then we pick pack it. So the fridges actually send us their inventory is real time, and a cost function algorithm runs that says this is where you should send all the food that you made. So we put that on refrigerated trucks, and then those go and they fill all the fridges. And so we do that at 400 locations across Chicago, Milwaukee, Indianapolis, New York, New Jersey, and Philadelphia. And anything that doesn't get sold, we pull back through the same refrigerated trucking system, and then we donate it to food pantry partners in those markets.
I imagine that has been very important right now for those partners.
Yeah, no, it continues to be very important. And it's something where I think the need there has actually gone up quite a bit. And to give you a sense in terms of volume, like we donate, I think, about 25,000 meals in February. So
Wow.
it's a fairly, it's a lot of meals that we're serving that way. And it's something we've done from day one, just because we knew we'd always have some unsold products and we didn't want them to go to waste.
Yeah, and I can only imagine that it's really strengthening those relationships with food banks and food pantries, and they're, I'm sure, very grateful for the continued relationship. Um, One of the things that I'd like to ask about is I know people are really concerned, when my husband has been like ordering stuff online and getting it here, and he's been disinfecting it before he'll like let us touch it. I wonder with your recycling program, how concerned are you about? I mean, I'm sure you're doing exactly the same things because no matter what, you want to keep the containers that you use sanitary, and you want to keep people safe in any circumstance. But is that more of a concern right now?
So actually the recycling is at the fridges. So recycling overall is down because less fridges are open. So really the only place where that applies is some of the hospital fridges. And generally speaking, they're like we wrap them up in a plastic bag, and the drivers have all the PPE, and then it's stored separately from any food. So I mean, I wouldn't want to stop recycling based on that, but
Sure.
yeah, I think it's fairly manageable, and not something that in any way comes in contact with the food.
Uh-huh.
Yeah.
And is the composting manageable at this point now too, or is it been disrupted?
No, actually, the composting is still happening. And yeah, so there's been no interruption on composting. I guess composting is essential services, similar to like how your trash is still getting picked up. So we haven't had
Absolutely.
any. Yeah.
So you've been talking a lot about your mission, which is, to make healthy food, as available and as accessible and as affordable as a candy bar. Do you think this pandemic puts that sort of mission at risk?
I think that it puts it at risk in the sense that it's a very difficult business environment to operate in. So our revenue was really impacted by everyone going to work from home, and
Right.
now bringing it back through home delivery and servicing hospitals. but just generally speaking, like those fluctuations, the fundraising environment, things like that, those all make it harder for us to operate. I think generally speaking, from a consumer standpoint, if anything, this increases the demand. It's your point. Like this is a time when people are thinking about it even more because they're trying to take care of themselves. And so I think in the long run, it actually is a benefit that for the market, whether or not Farmer's Fridge is is adapting to all of those changes is kind of a separate issue. It certainly makes it harder for us.
Sure.
I think for consumers, generally speaking, it makes the demand stronger, which ultimately means more people will step up to fill the need.
What resources do you need as a company, either from the communities you're working in or government, both local and federal? What sort of resources would help you the most?
I think a lot of the programs that the government is doing have been really positive for small businesses. From what I'm hearing, I think that timing of that stuff aside, the biggest thing we're looking for right now is for people to help make donations to feed the hospital workers. So we've actually had a number of our partners and investors make donations so that we could give meals away in the hospitals. So more than anything, that helps. We're doing it at cost, so we're not making any money off of those programs. And basically, it allows us to keep everybody employed and feed frontline workers. So if there's anything, it's just, I think, looking for ways to support your communities through those donations.
Absolutely. And just so that everyone knows how to get in touch with you all, it's farmersfridge.com. And I'm sure you have a lot of information about COVID-19 and what you're doing during this time on the website.
Yeah, all of our safety procedures, our delivery program, all that's on there.
Absolutely.
Yeah.
So what's making you most sort of hopeful during this time? I know you're talking to lots of different people. You're seeing your staff go through a lot. Is there, a way that, you're learning from the folks you're interacting with about how to sort of, survive through a crisis like this?
Yeah, I mean, I think learning a lot. So that's a long list. But what I'm seeing that's most encouraging is the way that communities are stepping up to help. I think that like the simple fact that people have prioritized social distancing and keeping people safe for the people that are most at risk is a great example of that. And I think the hoarding of toilet paper gets a lot of headlines, but we're actually seeing a lot of people reach out to us and ask like how they can help and how they can get involved and what they can do. We even had when it became clear that even just a cloth mask is better than nothing, we had members of our team, their family members, sewing masks over the weekend. So I've been really motivated by the fact that like the communities are seeming to come together at a time when it'd be really easy to not do that. Right. And then on the more personal side, I mean, it's actually been quite a learning experience to be working from home, and obviously still like going out, but for the most part, just getting to sort of like work alongside the kids and things like that. So it's interesting, and no travel, so I'm here a lot more time with.
I feel it. Yeah, I'm used to being on a plane every week, and so it's been a real learning experience for us at Food Tank to figure out how to deal with me being around all the time and sort of available. And so this is how they keep me busy. I get to talk to people twice a day, so I'm out of their hair. You mentioned community, and I think that's great that we're seeing so many examples of people rallying together and really coming together in different ways. Is the business community doing that, do you think? Are you learning from one another and sort of sharing, challenges as well as some of the sort of successes you're having during this crisis?
Yeah, I think that's true. There's not a whole lot of it's mostly people cooperating right now. So you look at like the restaurant industry, people getting together and starting funds to support workers who are unemployed right now or lobbying for support that can help their industry as a group. A lot of encouragement, a lot of entrepreneurs, like I'm getting on the phone with people and just sort of talking through like, how is this impacting you? What can I do to help? What can they do to help? So I would say generally speaking, I haven't talked to anybody who's talking about all the ways that they can, win against the competition in this environment. I think everybody understands that for businesses to do well, the community has to do well.
That that's good to hear,
Yeah,
because this could be a time where a lot of companies just sort of isolate themselves and try to beat out the other. So that's interesting to
I
hear.
think the magnitude of this is kind of unprecedented, and everybody
Right.
will tell you that there's no winners if this doesn't get better. We don't work together. So it's like I haven't, at least in my world, which might be not everybody, but
No, it's a little different, but again, it's really good to hear. I'm also interested in your thoughts on how this will change sort of eaters' perceptions around food. I mean, we've been talking about people hoarding. It's not just TP, but people are hoarding like food at their, in their homes and really scared about food price fluctuations, et cetera. But, this idea that's really behind Farmer's Fridge is, food is medicine, right? Like to serve healthy food so that you can live a healthy life. Do you think that eaters who aren't sort of part of the food movement world will understand that, or beginning to sort of understand that?
and like I mentioned, I think more broadly, whenever people are thinking, as much as we're thinking currently about our health, I think they're thinking about food and what they put into their bodies. And so clearly that's going to be top of mind. I think what I'm seeing that's really interesting is a lot of people thinking about the safety of their food.
Hmm.
So what are you doing to keep food safe? And that's
Hmm.
an area where I expect consumers to ask a lot more questions, and not just on things like ingredients they don't recognize or
Sure.
preservatives, but around like, no, actually, how are you making that? How do you ensure that it gets from where you make it to me in a safe way? And so I think that's actually where we're like, just as a general, like, what is the impact of that as things start to
Hmm.
come back online and people have lots of questions.
Hmm.
Um, so, yeah, I think in general, anytime people are thinking about their health, they're thinking about what they eat more.
Sure. I wonder also for you if, as this crisis continues and again, it's unprecedented, like you said, so we have no idea, how long this will go on and how long we'll sort of be physically distancing and sort of, not going back to normal. Do you think it will change what your products look like because, distribution will be different or look differently? Do you imagine sort of, different kinds of products, or do you still imagine, having fresh salads and things like that available? Is it
Yes,
something you've thought about?
I don't think we'll ever stray from the idea that when I think about what healthy food is, it's, simple, unprocessed, fruits and vegetables
Mm,
primarily. And so,
mm-hmm.
like, how do we get people their full serving of fruits and vegetables every day in a way that's appealing and affordable? And so I just don't see that part of it changing. That's just like more of a values based, mission based part of
Sure.
the business. Um, but like portion sizes, packaging, all of that kind of stuff, I do think is interesting and up for grabs right now. So like when we look at we launched the home delivery program almost 5 weeks ago, and now you have people that are ordering Farmer's Fridge for their family. And
Mm-hmm.
so like I order it to our house once a week, and I'm ordering chips and guac, which I love. I think it's a great dish, but now my boys are eating it too. So I have like a 1.5 and a 3.5 year old eating Farmer's Fridge on a couple times a week. And so you start to think about like, well, what could we do that's more conducive to families or like a meal?
Mm-hmm.
So just I think our way of operating, as I mentioned, hasn't really changed. It's about trying to understand what are the occasions where Farmer's Fridge is most needed, and then create products for those occasions around the guardrails that they're healthy, they're fresh, they get you fruits and vegetables. And so like we're looking at the occasion right now, and it's people that are at home with their kids, probably running from conference call to conference call, or
Right.
people who are stuck in a hospital, stressed out, working much longer hours than they're used to.
Mm-hmm.
So like just every time we see what our customers are going through, we look at how we can develop products that meet those needs.
That's great. We started this conversation before we went live talking about, the importance of of what you're doing for healthcare workers right now. And my co-founder, Bernie's wife, Victoria, is a nurse at Columbia Presbyterian. She's literally on the front lines every day. And how important, having Farmer's Fridge at the hospital for her and her colleagues has been. You mentioned that you've received notes, or that Farmer's Fridge has received notes that, healthcare workers are leaving on the fridges for you all. What would you like those folks to know? If they're thanking you, but is there anything you want to say to them, a message?
I think it's just, thank you for everything that you're doing. Obviously, you're putting yourself in harm's way to protect people, and I think that's a extremely important thing and very hard for people to do. And so what we do is like, if there's anything else we could do, frankly, to support you, I think, and I appreciate, like, a lot of them are actually leaving nice notes and saying things to our drivers, who are really, at the end of the day, going in and taking risks themselves to make this possible. So I thank you for thanking them. And if there's anything else we can do at Farmer's Fridge, let us know.
Yeah, thanks to all the drivers, all the stockers of shelves everywhere, the nurses, the doctors. It's just such a crazy time. Yeah, they need a lot of gratitude.
Yeah, exactly.
So I want to remind people, you can go to farmersfridge.com to find more information about Luke and their whole business model. I'm so glad you could join me today, Luke. I know it's such a busy time for you and the company. A reminder that this live cast will also appear on our podcast, Food Talk with Danny Nierenberg. So please sign up wherever you listen to podcasts. And please join me here tomorrow at 1 p.m. when I'll be talking to Maximo Torrero from the Food and Agriculture Organization of the United Nations. Luke, please stay well. Thank you again.
Yeah, thank you very much for having me. I appreciate it.
Thanks so much. Bye. Take care.